Thank you very much and good afternoon. So today we're reporting on our weekend numbers. So 3 reporting periods from January 8th to 9th. We had 538 new cases diagnosed with COVID-19 in British Columbia. From January 9th to 10th, an additional 507 new cases. And in the last 24 hours, 430 new cases. That brings our total number of new cases diagnosed to 1,475, including 9 epidemiologically linked cases, and our total in the province to 58,107 people who have been diagnosed with COVID-19. The new cases include 287 people in the Vancouver Coastal Health Region, 736 people in the Fraser Health Region, 59 people on Vancouver Island, 217 people in the Interior Health Region, 173 people in the Northern Health Region, and 3 who are new cases who normally reside outside of Canada. We currently have 5,220 active cases in all health authorities in British Columbia, of whom 358 are in hospital currently, 72 of whom are in critical care or ICU. We have 7,313 people under active public health monitoring in all of our health authorities, plus some additional in Northern Health. And 50,541 people have now recovered from COVID-19. Sadly, this weekend, we've had 22 more people who have died in our province from COVID-19. And that means now we have over 1,000 people, 1,010 people who have died from COVID-19 in British Columbia. These, of course, are our grandparents, our friends, our aunts, our uncles, our sons and daughters. To the families, care providers, and communities across British Columbia, we know that this has been a most challenging time. Our thoughts and our prayers are with you all. We do have 6 new healthcare outbreaks to report over the last few days at Avalon Gardens, the Gatehouse Group Home, the Guildford Seniors Village, Heart House Long-Term Care on Vancouver Island, Kin Village, West Court, and Sun Creek Village. And additionally, 4 outbreaks have been declared over at the Abbotsford Regional Hospital, and thankfully the outbreaks at Bailey House, Chartwell Langley Gardens, and Lakeshore Care Centre have finally been declared over, and we know how challenging those outbreaks have been in all 3 of those long-term care homes where we've had numbers of people, our seniors, who have died from the virus in those outbreaks, and it's always challenging. We now have 50 active outbreaks in long-term care or assisted living and 10 in different acute care units, involving 1,364 residents right now and 669 staff who have active cases. Today, we've had 1 new community outbreak declared in Canham Lake First Nation in the Interior Health Region. In addition, the LNG Canada Diversified Transportation Site in Kitimat, that outbreak is now over. Since the start of our immunization program in December, we have now delivered 59,902 vaccinations as of yesterday, so it doesn't include today's doses, but that's 59,902 of the 71,200 doses that we've had here in the province. That includes 48,533 of the 50,700 doses of the Pfizer vaccine that we received, and 11,369 of the 20,500 doses of Moderna vaccine. And we recognize we've put less Moderna vaccine in arms to date, but there's really good logistical reasons for that, as the Moderna vaccine is what we've been able to deploy to many of the more remote or isolated communities, including some First Nations communities, and the flexibility that we have with the Moderna vaccine makes that possible, but it also makes it challenging because it does take much longer to get out to communities. We do expect to fully use up all of the Pfizer vaccine that we have in the province by today, and we are awaiting our supplies to come in the coming days. As well, we're awaiting an additional shipment of Moderna vaccine this week. As we spoke about last week, much thought and consideration has gone into our immunization delivery and approach, and we started slow and steady and made sure we had all of the building blocks in place. The approach is based on our available supply, where the highest risks in our province and who is at risk to be mostly severely impacted by the virus. And this has been the approach that we've been taken, recognizing that we have a limited amount of vaccine that is coming between now and the end of March. Everybody is important in British Columbia, and everyone who is wanting the vaccine and is able to receive the vaccine will have access to it. But we know that some people are at higher risk, and that is why they are getting immunized first. If someone's at higher risks, it means they're either more likely to have severe illness, or their circumstances or activities make them more likely to be exposed or to potentially spread the virus. And that is what we're focusing on at first. We do not have enough supply coming between now and the end of March to achieve that community immunity that protects us all. So what the approach that we are taking, as with other provinces across the country, are to best protect as many people who are most at risk as possible, to prevent hospitalizations, to prevent deaths, and also those people in our healthcare system to make sure that we have the resources available to provide safe care to everybody. But let me be clear, everybody will have their turn. The focus is on these core groups between now and the end of March, but we expect more vaccine and more vaccines to be approved for use come March. And starting in April, we are working on the details of how we are going to sequence once we start having sufficient vaccine that we can immunize more people in our communities across the province. These details will be coming. So if you haven't seen your name on a list for after March, it's because we are working out those details both here in British Columbia and across the country. But we will absolutely be looking at our essential workers across the board. We will also be ensuring that we make allowances for people who are at risk by age, by underlying conditions, etc. So those details are coming, and we just need everybody, please, to be patient. I also want to address the decision that we have made to start giving second doses at day 35. This is a science-based approach that takes into account the limited vaccine we have early on in the program here in the province. As we know, when someone receives a vaccine, it stimulates our own body's immune system to produce antibodies to that antigen, that protein. And these new vaccines that we have, messenger RNA vaccines, have proven to be very effective at doing that. When you provide the second dose, that's what we call priming the immune system with the first dose. The second dose in a 2-dose series like this is to provide more durable and longer lasting, for a longer period of time, immunity. And that's what we call a boost. And we call this a prime boost. And we know a lot about immunization programs and our body's immune system and how they respond. By waiting between doses, it allows the body to build up that immunity, to be primed, to develop both the antigens, the antibodies that attack the proteins on the surface of the virus, but also for the body's cell-mediated immunity, our T cells and our B cells, to start to recognize the antigen or the offending protein, the virus as well. Right now, as I mentioned, we are vaccinating as many high-risk people as possible in this initial period and setting the second dose to just over a month later. So that is the process between December and March. And that is because we know that the vaccine that we are receiving, will be receiving, if it comes, as we've been guaranteed or we've been told, will be back-end loaded. We are getting more doses in January than we did in December, more doses in February than we did in January, and more doses in March, quite a large step up in March compared to January and February. So our decision is around maximizing the distribution while balancing the supply and making sure we have a safe and effective immunization program. And we did not take this decision lightly. It was made after reviewing the scientific evidence here in BC, but also nationally and internationally, in consultation with the immunization experts that we have here in British Columbia. We have a very strong immunization program led by Dr. Monica Naus at the BC CDC, with our Vaccine Evaluation Centre and our BC Immunization Committee. As well, we have looked at guidance from the National Advisory Committee on Immunization in Canada, which is our number one guidance committee to go to around everything to do with immunization programs in Canada. And they have had access to all of the data around the Pfizer and the Moderna vaccines. And they have experts on the National Advisory Committee table. I have been on it myself in the past. And that is where our basic expertise and recommendations come from in Canada. As well, here we reviewed the WHO SAGE Committee recommendations and the Immunization Advisory Committee recommendations from both the UK, the US, and other countries. What we know based on the data from the clinical trials, both that's been published and that's been provided to the National Advisory Committee on Immunization through Health Canada, the data that we know from the trials shows that between the first dose, with 2 weeks after the first dose, so that gives the body's immune system time to develop the antibodies and the cell immunity that they need, the vaccine effectiveness, so the protection from the vaccine at 2 weeks after the first dose, was 92.6% for the Pfizer vaccine and 92.1% for the Moderna vaccine. That is, quite frankly, amazing from a public health perspective, looking at an immunization program. What we're learning is that this short-term protection is achieved rapidly and is very high. So the protection after the second dose in these clinical trials went from 92.6% to 94.8% for the Pfizer-BioNTech vaccine, and went from 92.1% to 95.2% for the Moderna vaccine. So what you can see is that the data from the clinical trial shows very clearly that we have early, sustained, high response to this vaccine that lasts for at least 8 weeks. And I say that because these trial data also show us that the people who were in the Pfizer vaccine trial received their second dose from day 19 to 42. And the Moderna trials, they received the second dose day 21 to day 42. And there was no difference between the people who got it at day 19 and the people who got it at day 42 in how well the vaccine worked after the second dose. And there was no decrease in protection between the first dose and the second dose. So these are important things for us to remember. What we know is that it's much more important with a prime boost vaccine series not to give the second dose too soon, because your body does not have time to build up that priming in the immune system, and it's essentially a wasted dose. But we also know that for many of these two-dose programs, the boost is actually more longer-lasting and stronger if it's given later than the recommended time period. That we don't yet know, but we will be monitoring carefully for that. The WHO and NACI now have extended the interval, the recommended interval for doses, to 42 days, recognizing that that was perfectly safe and effective in the vaccine trials. And that is, we use that information along with our supply to try and get a nice, safe, and effective way of providing as much immunization as we can to high-risk groups during a safe and effective period. I will also say that there's been some discussion about a theoretical risk of increased pressure that might allow for a vaccine-resistant strain to arise if people don't have the second dose in a short period of time. And really this is, in discussions with our immunology colleagues, this is theoretical and really is not expected to arise with the very high levels of protection that we're seeing after the first dose, or in the particularly short time frame that we're talking about, the difference between 28 days and 35 days, for example. And we know that from the doses that we're expected to receive, that we can protect an additional about 150,000 people who are at high risk in our province by starting our second doses at day 35. Given what we know about our immune system, what we know right now about these very effective vaccines, and how much vaccine we will receive, and we did an ethical review of this as well, and I will refer people to our ethical framework that's posted on the BC CDC website around our immunization program to make sure that we are being transparent about all of these processes. And we believe this is a reasonable and safe approach in our construct right now of limited supplies at the front end. We will, of course, continue to monitor carefully, and we'll be watching what is happening around the world, where we are looking at vaccine effectiveness, how long that protection lasts. In the UK, when they are extending to 12 weeks, is there an issue in between the 6 weeks and 12 weeks, for example? We'll be watching all of that very carefully, and we'll be monitoring and changing our program if needed, depending on how much vaccine we have and what we learn about the effectiveness of the booster dose. At this time, we are that much closer to the end of this storm. We cannot now abandon all that we have stood for and all that we have done here in BC to hold our line and protect our communities. We will get through this by lending a hand, by giving a wave or a smile, even behind your mask, to your neighbors, your friends. Kindness, compassion, tolerance, and understanding for each other is what we have taken as our mantras to get through this last year. We need to remember that now, as we are coming to that end game, as we are going through this period that is the most challenging. We have limited vaccine, we still have this virus circulating, but we know we can get through this. We know that these are the things that have got us this far, and they will get us through this next few months as we get more and more people protected in our community. Using our layers of protection, sticking with our fewer faces, making sure we are unwavering in our focus, no matter how much we want to ease up. These are the things that will get us through these next few months, and then we'll be closer to the spring and closer to the light. And we will make this happen by remembering to be kind, to be calm, and to be safe. Thank you.